Hi, I am Dr. Maninder Dhaliwal and I would like to tell you about the Paediatric Intensive Care Unit, otherwise called as PICU, in Amrita Hospital, Faridabad. We are a large pediatric center with modern machines, latest technology to provide the highest standard of care for critically ill children. We strongly believe parents play an important role in the road to recovery for their loved ones, and we encourage them to be partners in care. It is in human nature to be worried when a loved one gets admitted, and more so when a sick child gets admitted in the PICU unit. We understand PICU can sometimes look scary, not only for the child but for the families as well.
A child gets admitted to the PICU because of a variety of problems. Most of the problems are acute, and in these situations the family is absolutely unprepared for the emergency admission. Sometimes there is a planned admission to the PICU, for example after a surgery in which there is an expected post-operative ICU stay. One of the most common reasons for admission to PICU is infections, especially when they get severe, like dengue, pneumonia, malaria, etc. Some other reasons include fall from height and road traffic accidents, and also accidental ingestions, and apart from these, severe allergic reactions and bites, etc. Children who have chronic medical conditions like malignancies end up into complications, and in these situations we care for these children in the PICU.
After any major surgery, the kid goes to PICU. Here we take care of them as an anesthetist and as a PICU intensivist. We are clubbed here, we are together here. And at Amrita we have a different work culture. The protocols, the drugs, equipments, they are at sync with each other. We use the same drugs, same equipments in PICU as well as in the theatres. And that's why we are giving the best possible results. The treatment not only starts at intraoperatively with the operation, but it starts way before that.
It takes a whole team of dedicated experts to provide care for a sick child. The multidisciplinary team includes pediatric intensivist, many pediatric subspecialists, pediatric respiratory therapist, physiotherapist, dietitian and social worker, and this is all under one roof.
This is a very vulnerable time, both for child and the parents. Some such children may require ventilatory support, insertion of invasive line, breathing support, breathing and feeding tube and other procedures.
When a child is getting stable or recovering well, we encourage them to do activity which they like, just like drawing, coloring. Our occupational therapist has an important role in rehabilitation.
A single cubicle PICU is an added advantage to ensure least disturbance to the child from the noises of corridor and other patients, and also the risk of cross-infection is much lower. Equipment like monitors, infusion pump are constantly running in the PICU, and we make the child and the parents to understand about the tubes and these equipment and how to be careful around them.
We provided a specific meal to children and plan nutritious meal as per their medical requirement in accordance with their likings. Nutrition requirement after surgery is different as compared to sepsis and so on. Every child is given individualized diet chart.
We make children to do age-appropriate fun, breathing and physical exercises to make them heal and recover fast. Exercises plays a vital role in the overall recovery of the children, and parents are taught these specific exercises for better outcome and early recovery.
We strictly follow hand hygiene in our PICU and also teach parents, children about hand hygiene by fun games. Hand hygiene are stressed at important moments like on entering the PICU, before touching the patient, after touching the patient, after touching body fluids, and after contact with patient surrounding.
Pediatric physical therapy treatment is based on a number of hands-on techniques, exercises and intervention with the goal of addressing functional impairments including muscle tone, strength, coordination, balance and posture, mobility, and achieving an optimal range of motion.
Thank you for trusting us with your child's care.